Hello and welcome, whatever time it is and wherever in the world you find yourself. My name is Sam Welch. I'm a PhD student on the European Eco-Risk 2050 Innovative Training Network based at the Norwegian Institute for Water Research in Oslo, Norway. Today, I'd like to introduce some of the earlier findings of my work predicting the environmental risks of pharmaceuticals in Norwegian surface waters. Let's dive right in. And where better a place to start than the end? If you skip the rest of this video, you'll miss some pretty exciting graphs, but please at least take with you these three key points. We used national drug sales to predict environmental concentrations of pharmaceuticals in Norway. We use PECs and publicly available toxicity data to assess environmental risk. And we believe this approach may give a more accurate measure of PECs than existing predictions based on dose and market share. Still here? Great. Let me take you then on an adventure in time and space. Our destination is Norway and the year 2050. The first thing we notice about the Norway of 2050 is that there are about 20% more Norwegians hanging around, largely immigrants like myself. And these Norwegians are also on average older. Gazing into the crystal ball that is Statistics Norway's demographic projections, we can see that barring any nasty surprises, the proportion of the population over 60 is going to increase considerably, with a commensurate rise in the consumption of the sort of drugs that old people take. Turning our eyes skyward, we can see that the country will also get considerably hotter, wetter, and more variable. Quite what this will mean for risk assessment is beyond the scope of this presentation, but I think I can say without fear of contradiction or need for citation that the risk landscape is going to get considerably more complex and congested in the coming decades. This is a problem for all of us, and a problem for me specifically because it's my job to predict the risks of pharmaceuticals in Norway by the year 2050. Within the European Union and the European Economic Area, of which Norway is a member, it's also a specific problem for the European Medicines Agency, based in the Netherlands, which is responsible for, amongst many other things, the environmental risk assessment of medications. The EMA's powers are set out under the unfortunately uncatchy Article 8 Bracket 3 of Directive 2001/83/EC, as amended. Actual risk assessment guidelines are laid out in a protocol first established in 2006 and currently under revision. The current protocol, although relatively simple and accounting for risk arising from toxicity, bioaccumulation, and persistence, is not without its peculiarities. Risk assessments are conducted per company per substance, creating considerable duplication of work and potentially inconsistent findings, while environmental concentrations are predicted from comparing estimates of market penetration to the population of a given market, rather than on any kind of empirical use data. Norway represents a unique opportunity to refine this approach, given the Norwegian Institute of Public Health's long-standing practice of collecting high-resolution data on wholesales of pharmaceuticals. Over the past year and a half, we've worked to convert the data for 2019 from a market and medically orientated dataset to something more useful for ecotoxicology. Getting into this data requires a bit of explanation to make sense of it all. I'd like to introduce you all first to Anatomical Therapeutic chemical classification codes used in the medical world to classify drugs. Without going into a detailed analysis, ATC codes are based on target organ, drug class, and chemical structure, and are extremely useful for classifying substances with broad strokes, and less useful if you want to be chemically specific about active pharmaceutical ingredients. One API can represent more than one ATC code. One ATC code can refer to more than one substance. It can all be a bit of a mess, but it was still the easiest way to move forward. One API can represent more than one ATC code. One ATC code can refer to more than one substance. It can all be a bit of a mess, but it was still the easiest way to move forward. Before we turn our attention to actual predictions of risk, here's the first of the promised pretty graphs. A quick explanation: this rectangle is a group of drugs categorized by its level 2 ATC code. At the top of the rectangle is the code, in this case C09, and at the bottom is the name of the group, renin-angiotensin agents, largely blood pressure drugs. The number in the middle is the number of Norwegians in 1,000 who take the daily defined dose of this category. We also use this measure of proportionate use to scale the rectangles. I hope that all makes sense. And here's the rest of the graph. We can see that a lot of people are taking heart medications, nervous system medication, largely painkillers and caffeine, respiratory drugs for chronic conditions, birth control, and a wide range of alimentary tract agents. An in-depth look at the demographics behind is beyond the scope of my work, but I would expect to see the big use categories get bigger as people age and accumulate chronic diseases. There will undoubtedly, however, be some surprises. Toxicity testing, meanwhile, for APIs is generally conducted by industry, which can make data hard to get hold of. Environmental risk assessments for many products marketed after 2006 are available on the EMA website, although they're often unhelpfully vague. This leaves the website Pharmaceutical Specialities in Sweden, or FAS, as one of the most consistent sources of data, although there are still gaps in what we can get toxicity predictions for. Next up, we'll take a look at risk. Now, I couldn't find a way to make this graph entirely intuitive, so it gets an introduction as well. On the horizontal, we have our predicted environmental concentrations, lower on the right and higher on the left. On the vertical, we have our predicted no effect concentrations sourced from FAS, with lower values meaning more toxic at the top and higher values, less toxic, at the bottom. If we divide PEC by PNEC, we generate a risk quotient. I've depicted it with a chartreuse line on the graph here. This is the risk quotient equals 1 cutoff. Conventional wisdom is that anything above the line is bad and everything below is fine. And just for the sake of clarification, lower risk chemicals, substances, are in the bottom left-hand corner. Higher risk chemicals are in the top right-hand corner. And here's the data. A big caveat here is that we can only calculate risk quotients for substances we have toxicity data for. So please don't treat this as exhaustive. Still, a few things jump out at us immediately. Sex hormones, especially estrogens like levonorgestrel and ethinyl estradiol at the middle top of the graph, are extremely risky because of their toxicity at nano concentrations, while common over-the-counter painkillers like ibuprofen, paracetamol, and naproxen are lower risk despite their higher predicted environmental concentrations. If we separate out the APIs by target organ, we can make some slightly more nuanced points. APIs are likely to share modes of action with others in their class, so there's real potential that both we and existing regulatory risk assessments are underestimating mixture effects. This graph does also show one of the weaknesses of clustering by ATC. Staple medications like ibuprofen can pop up in a wide range of classes depending on route of application and target organs. So what's next? Well, the obvious answer is validation. At some point, I'm going to need to go out into the field and actually sample some water. One thing I am 100% sure I will find in that water is salt, because a very big issue with the model I'm using is that Oslo, for one, does not release wastewater into rivers, but rather to the Oslo fjord, which with a salinity in the 20 to 30% range is definitely not a freshwater river with freshwater species. Step 3 is to start doing something with region data. Further north in Norway, wastewater treatment largely consists of releasing effluent straight into the fjord, which offers a potential to examine the role of treatment and temperature differences in the evolution of risk. In the more distant future, I hope to develop a probabilistic risk assessment approach using a Bayesian network. I'm sure you're all very excited about this, so please do come see my poster in the Bayesian network session. The poster ID is 5.01.03. All that leaves is for me to thank my colleagues and supervisors. Sophie Menzel and Taylor Lane, also of the EcoRisk 2050 ITN, have presentations, and I have a Twitter account at Sam Welch, and I would of course be indebted if you would visit it and make either flattering or constructively critical posts on there. Thank you all for your time and attention, and I hope you have a good SciCon2. Goodbye.